My name is Dr. Miya Bazley. I'm a chiropractor. I'm a partner with Kygo. I decided to become a chiropractor in high school. I was playing sports with other kids, other students, and realized how many of us were having career or season-ending injuries, even though we were 15 or 16, and also developing back and knee pain, supposedly when we were in the prime of our health. And I thought there had to be a better way. There's something that we must be missing, even though we had access to medical care, athletic trainers, all of that. It was just shocking to just see young people go down with such with non-contact injuries. And I looked into chiropractic care and decided then, I was 15 years old, that I wanted to be a chiropractor. Made all my decisions for education afterwards wanting to be a chiropractor based off of wanting to become a chiropractor. So I have been in practice now for 10 years. The typical patient is usually someone who wants to move better. I know that's a sort of a general way of putting it, but the typical patient can be a mother who wants to play with her kids more or is noticing pain getting them in and out of a car seat. It could be an uncle who is trying out or training for a triathlon. It could be a senior citizen who wants to stay active. Chiropractic patients usually don't want to take medication or take any more medication and are also trying to avoid surgery. But they're truly people who just want to maintain their activity level. That's a typical patient. The most important thing to remember is probably what the keystone of chiropractic is that we're a hands-on profession that is drug-free, surgery-free, and we are trying to get you to move better, usually by working on the musculoskeletal system. There are some things that are ancillary to that, but the keystone of it is to get you to move better by working on the joints, working on the muscles, and trying to free up the nerves so that you feel less pain. I think what we all can do is move more, not just to prevent pain, but also just for a better sense of well-being. Is stop smoking. That's another big one, and try to limit being seated for more than 2 hours at a time. And to get evaluated, try not to wait to the last minute when the pain is crippling, it's intense, you have tears in your eyes, or pain radiating down into your toes. That's when I would say that you don't have to wait for it to be painful to get evaluated. It could be tension, it could be that you notice you're not sleeping as well. You could even notice that your golf game feels stiff, and for some patients, their ability to golf with their clients is important. So those are things I would say that I would definitely recommend to the general population. To people that are definitely busy professionals in the city, I would honestly say, other than to use Kygo services, is just try to stay on top of your healthcare. It's if you need someone else to manage it for you to make sure you make your appointments, that's great that you at least realize that, but make sure that you keep your appointments, that you get a physical, that you get checked out, that you get evaluated. That could be 30 minutes of your time spent very wisely to keep you from not spending all night tossing and turning in bed with back or neck pain. But what I do here, how I summarize it, is that it's functional conservative care for life's aches and adventures. And sometimes that could be very simple as just hanging out with your friends and not being able to sit on a couch without discomfort. That affects your ability to enjoy life. And then there's things that are more serious. From the low back pain prevents you from working. That would be the aches and adventures that we all need to conquer to get the most out of this life that we're given. So as a chiropractor, I definitely want to work on those things. I want to approach healing from a drug-free, surgery-free perspective as another way of looking at your condition or at a problem. And also, though, it gives me a chance to work with other professionals who are coming from a different direction and collaborate together to make sure that everything has been looked at, everything's been evaluated. And I don't mind being that third voice to the party saying, oh, have we looked at this? But it truly is just about not being able just to get you to work, but getting you to enjoy what you already enjoy, whether that be tennis, whether that be hanging with your grandchildren, whether that be working as many hours as that you need to work to support your family. That's why I'm here. That's why I'm a chiropractor. I get excited just even talking about biking. I love biking in the city. I think Washington, D.C. is a great city to bike around. So that's how I truly like to enjoy my time outside the office. And also building community. The neighborhoods in D.C. and the surrounding area, there's just so much to do and so much to work on to just make all the neighborhoods great. I really love community building. I think that's also another reason I love being a chiropractor and interacting with so many different people that I would not have met if I was probably not in the profession, and just all the different ways I can help. Even if it's someone with their biology homework, I enjoy those things. So that's what I like to do.